I was preparing all of these questions the night before. I thought they might ask me. And basically everything that I practiced for, unfortunately, they didn't ask me that. They asked me totally opposite. So hey guys, welcome back to my channel. I hope you're all doing well. Thank you so much for joining me once again back onto my channel. My name is Belinda, and if you've not already subscribed, please don't forget to press the subscribe button as well as turn on the notification bell so you get a notification every time I upload. This is a nursing based channel, all things nursing as well as bits of other things as well. As you read from the title of this video, guys, today we are once again back with another nurse video. And this time around, I'm just going to be talking about newly qualified nursing job interviews. So if you are in your second year, going to your third year, and this is basically the time to, start thinking about the kind of job or what kind of area you're going to go into or specialty you're going to go into, this is the time for you. Or if you're in your third year and you already started looking around and applying for a job and you are waiting to be called for an interview, then this video is for you. Okay. So I'm going to tell you guys, basically going to be a newly qualified nurse, the kind of questions that they're going to be asking you guys in your interview, because this is what happened when I went into my second year, going into my final year. I applied for a newly qualified nursing job in A&E, and I was preparing all of these questions the night before, trying to figure out what kind of questions they're going to ask. I basically went over the news, which is the National Early Warning Score, determine all the vital signs, what is the normal range of it, just basic things that I thought they might ask me. And basically everything that I practiced for, unfortunately, they didn't ask me that. They asked me the opposite. So in this video, basically, I'm going to tell you guys what I thought they were going to ask me versus what they actually did ask me. And I'm just going to share with you guys a bit of advice from my own personal experience in regards to this aspect. So if you are interested in this video, keep on watching. So like I said before, I started off with applying for a nursing job. In my final year, I started applying for a newly qualified nursing job. Some people might say that's a bit too early. Whatever, honestly, it's up to you when you feel you are ready. Applications open a year into, or a few months into your final year. So basically you can apply for a newly qualified nursing job ending of second year going into your third year. You can be able to do that. So what happened is, I thought they would ask you for scenarios. When I spoke to previous students, they said to me, initially give you a scenario as well as a patient's news, which is the National Early Warning Sign charts, to determine what kind of sickness this patient is suffering from, whether they have sepsis or not, taking into account patient's temperature. So I thought they would initially gonna ask me scenarios of various patients, and I will need to be able to identify whether the patient is deteriorating as such or not. So basically I studied and looked at news charts, various news charts with various vital signs on it, just to determine whether the patient is stable or is the patient scoring, or whether the patient is deteriorating. So that's basically what I was looking at. I knew they were going to ask questions like strength and weakness, because I know in most interviews they normally always ask you about your strength and weakness. So that is what I studied for. However, the day of my interview, because I had my interview online because obviously of this pandemic, they asked me opposite to what I actually prepared. So I'm going to tell you guys basically what they actually asked me. Okay, so first they asked me is, what skills have I obtained throughout my nursing course? Now when they say skills, I thought initially they were talking about communicational skills, anything that will make you a good nurse. No, that's not what they asked. What they actually asked is, what skills have you obtained? Now what they mean is, if you are a nursing student here in the UK, you've got a skills log. So they're asking those kind of skills, like, are you able to cannulate a patient? Are you able to take blood pressure with a stethoscope, manually rather? Can you put a catheter into a patient? Those are the kind of skills that they are looking for. Are you able to identify a deteriorating patient? How are you able to identify a patient that's deteriorated or deteriorating? Those are the kind of skills that they're asking. So if you get that kind of question, you would want to look at your skills log book or your skills log journal that you have from the university that have been signed off, because all those that have been signed off basically is an indication that you have obtained those skills. Okay, so that's what they're looking for. They're not asking about your communicational skills, empathetic skills. They're asking about physical skills that you have obtained. Then I also was expecting them to ask me about the 6 C's. 6 C's of nursing, which is care, compassion, commitment, competence, communication, as well as courage. I was reading around that and I thought they were going to ask me that question. Unfortunately, that question did not come up as well. However, they did give me a scenario about family members complaining about the type of care that a patient receives, how you would handle that. So obviously that's how you can implement the 6 C's in answering that specific question based on that. In addition to that, there was a few drug calculations, but not hefty drug calculations. Now, what I mean by hefty drug calculations, they're not going to ask you about IV rate calculations and all of that. They're just going to ask you simple calculations, about converting maybe milligrams into gram tablets. How many tablets should the patient get? And they will give you some time to obviously work through it. So that was also another thing to take into account. And I know previously people said they would ask you to write certain English exam or an English test just to see your competence of English. However, this time around, like I said, because everything was online, they did not ask me for that, but I prepared myself for that as well. So once again, I prepared for something that was not included in the interview. They will ask you, like I said before, about your strength as well as your weakness. You want to talk about the good quality that you have obtained as well as not so good of a quality. Obviously, you don't want to put yourself down to the extent that they look at you and question whether you would make a competent nurse in that specific hospital or not. The last thing you want to do is you don't want to say that you are not good with time management, because as a registered nurse, that is one of the most important aspects, time management. Rather talk about something else, something like, which is a good point to bring out, is that you have a weakness of delegating tasks. That weakness doesn't make you seem too bad as a newly qualified nurse, because they will tell you that they will train you on how to delegate tasks during your preceptorship program. They will ask you about how to deal with conflict. I think they ask that in everything. How do you deal with conflict? Are you able to work within a team as well as have the initiative to obviously work independently? Another advice that I want to give you guys is to obviously do a bit of research on the hospital that you're applying for. So various hospitals have various different trusts, and various different trusts obviously has various different policies as well as procedures. So read okay, about the hospital trust, what it's about, what they're expecting from their employees, so that way you get yourself more familiarized, and in case they do tend to ask you questions in regards to the trust, you are aware of it and you are able to answer that question to the best of your ability and to the best of your knowledge. Obviously, prior to getting into the interview, you would want to go through the description specification of the specific job, what is required from you. That way you can prepare yourself, obviously, to know whether they're more likely going to ask you. Once again, guys, I do want to say, obviously, this depends from hospital to hospital. So if you are like me, and you want to prepare yourself for a job interview question, in depth, then, just read around everything really. So you've got a clear basic foundation about what they might ask you. So although they didn't give me a specific scenario, it's just good sometimes to be able to rehearse scenarios, which gives you that preparation in how you're going to be able to answer the question in case a scenario question does come up. They're going to ask what you would like to achieve long term in the future in regards to your career. And when I wrote personal statement for the job application, they would say in your requirements that you have to list at least 3 specialty wards that you would like to work in. So in the interview, I remember with my personal experience, they asked me what are my specialty wards that I would like to work in. So I mentioned to them that I would like to go into A&E, ICU or surgical, but the top of my list was A&E, just because I feel like I'll be able to obtain quite a number of skills. Not as such me working there on a long-term basis, but as a newly qualified nurse, working in A&E will give me the necessary experience or will allow me to obtain a certain amount of skills. So that's why I chose A&E. So further on, they will ask you other questions such as what are your proudest nursing achievements that you have obtained. This can be anything from your clinical placement experience, what you feel like has been the proudest moment for you. questions about how you would deal with constructive criticism, as well as how do you deal with mistakes that you might have made in the past. They will ask you questions. I remember they asked me questions: what does equality and diversity mean to me? So how I would define it, how I would place it on patients, and also read around. I don't know if I've mentioned this before, it's just read around, be up to date with what's currently happening within the healthcare sector, because chances are they are most likely to test you or check your knowledge if you know what is happening at this current point in time in the healthcare sector. This shows some sort of commitment that you are very serious about the kind of job that you're going to go into. Obviously, I'm not saying, you know, read everything to the T, but you know, it's good to from time to time sit in front of the TV or, you know, read an article in newspaper about what's currently happening in regards to current challenges. For example, at this point in time, they're talking about not having sufficient PPEs and also what they're going to do about it. And at this point in time, what everybody's talking about is obviously the COVID-19 as well as vaccinations that are being put in place. That's what's currently happening at this point in time. So by doing this, you're showing basically the people that are interviewing you that you've got some sort of knowledge or what you know about the kind of prospect career that you're going to go into. They will ask you what confidentiality means to you. It's nice to not only give them a straight answer, it's nice to elaborate or even give examples if must be. So obviously confidentiality of the patient, confidentiality of your fellow work colleagues, and give a scenario what you mean by that. The main thing when you are doing your interview is to listen clearly to the questions, because sometimes you think they might have asked you something and then they ask you something else. I mean, like I had that experience, like I said before, where I thought they were asking me something else. In the meantime, the question was placed for something else. So just listen clearly about what they are saying. So if you're applying for specific specialty, know what that specific specialty is about, what is expected from you when you're entering to that specialty. That way, when you are telling the people that this is what you want to go into, they have some sort of idea that you know what you're going to be expected to do in regards to work. In addition to that, they will always most likely ask you if you've got any questions for them. I would highly tell you guys to ask questions, because ask relevant questions such as what opportunities is there for me to progress within the hospital. Ask them about the preceptorship program, what it's about, how long it will be. Asking them questions will come across as if you are interested, which is the whole point. You do want to come across as being interested, obviously, in the job. Lastly, they were also asking me how I deal with stress. I think stress is such an important thing in regards to this job, because this job can be very stressful. It can really burn you out very quickly. So they were asking me questions about stress. How do I deal with stress? So mention things like reading or, you know, yoga, I don't know, something along that line, you know, shows that you are actually dealing with stress. These interviews, guys, I remember when I had my interview, 2 people were sitting there. Obviously, like I said, I had it actually right here where I'm sitting. This is where I had my interview. I had my laptop in front of me, and it was a webcam interview, obviously. And make sure, you know, especially with everything being online, you have proper connectivity, because chances are that something might happen that you might not have the adequate. So just prepare yourself beforehand, sit down beforehand, you know, just to have some sort of feel about how it may be. And yeah, enjoy the process. I mean, like, at the end of the day, guys, the truth of the matter is chances are that they will hire you unless there is high competition for the job. I know this is a time where the university has released a few posts for 3rd year students going to be newly qualified, and there is a high number of competition. However, for me at this point in time, I was lucky because I don't really stay in that area where I'm going to university. So this, guys, is just basically my own personal experience in regards to, you know, the interview process of a newly qualified registered nurse job. This is basically my personal experience, as well as my small tips that I could give you guys that will most probably help you. And yes, guys, this is the end of my video. If you've got any more further questions, please don't forget to comment that below or head over to Instagram and ask me that question. And yes, guys, this brings me to the end of my video. I really hope you like this kind of video, guys. Please don't forget to comment, like, and subscribe, and I will hopefully see you guys in my next video. Bye.